A message about COVID-19 from the Rhode Island Department of Health. From Dr. Jim McDonald, Medical Director. To attendees at Hot Topics and Cool Ideas, Rhode Island's 2021 Statewide Self-Advocacy Conference.
I'm Dr. Jim McDonald, Medical Director of the Rhode Island Department of Health, and thank you for letting me be part of your experience today. So, one of the things I reflect back on the pandemic in Rhode Island is, our first case was February 28, 2020, about 16 months ago. One of the big messages we kept telling people in the beginning when we started shutting down our economy was, we really need to wait till we have a treatment or a vaccine, but we really need to do what we can to minimize people's exposure. Well, we gave the first dose of vaccine in Rhode Island on December 14, 2020, a little under 10 months into the pandemic in Rhode Island. So that was a big win. But even before that, we had monoclonal antibodies to treat COVID-19. Since December 14th, over 70% of the state is in a good place, is getting at least one dose of vaccine. And we're really heading in the right direction as far as hospitalizations, deaths, and really just people having cases. So we're really moving in a positive direction. That didn't happen by accident. It happened with everybody in the state pulling together, doing the right thing. It's funny though, there is some things that we need to know now. And I feel like sometimes when we talk about the pandemic, people are like, well, I've heard that story before. Because you remember in the beginning, back before the pandemic came to Rhode Island, they talked about a virus in the Far East. And I don't know if you paid much attention to it. A lot of us didn't really. But then it came, and then it's like this scary virus no one has any immunity to. And I feel like a lot of times we keep telling you that's what's happening. There's a scary virus coming and we don't have immunity to it. And when we hear about the variants of concern, I'm afraid that's what people are hearing, and that's really not what's going on. The variants of concern are viruses related to the SARS-CoV-2 virus, or just genetic mutations from that. However, they're still covered by the vaccine. And I think that's just an important point to remember. Variants of concern are still addressed by our vaccine. It's still covered by the monoclonal antibody, the Regeneron product that we have to offer there. So that's the threat right now. Now, you hear a lot about the Delta variant. Right now, the Delta variant is about 10% of cases in the United States. We're still seeing it in Rhode Island. We think we have a little more than a handful of cases right now, but it always lags, so we know it's here. Why the Delta variant became a concern, though, is because what we noticed from the United Kingdom was it's more likely to spread from one person to the other. So it's more contagious. It looks too like it causes as severe disease or maybe a little bit more severe disease than what we see with the original SARS-CoV-2, which a lot of times just call that the wild type. So I just think it's important to understand that when we talk about the variant, we call it the Delta variant. Now, I think some people are like, why do they keep changing names of this virus, right? In the beginning, it was called novel coronavirus, and they called it SARS-CoV-2. Then we talked about the B117, the P1, the B1351. Well, why are we calling it the Delta? So the World Health Organization decided, without asking me, mind you, that all these viruses that are variants would be called letters from the Greek alphabet. Now, I don't know why they chose the Greek alphabet, because quite frankly, unless you know Greek, you don't really know the Greek alphabet. I had to look it up, right? If it was up to me, I would have gone with A, B, C, D and told everybody in their language, you can pick whatever your A, B, C, D is. But that's not what they did. So there was an alpha, there's a beta, there's a gamma, now there's a delta. Those are variants of concern. If it's a variant of concern, that means it's more transmissible than the wild type and may cause more severe disease. There are other variants of interest, which are still something we know about, but they're not as transmissible. Now, in case you're curious, those are named all the way up to the Greek letter of lambda, which goes up to the letter L. So there we go. Not super worried about those because they're not a variant of concern. So I'm not worried about variants of interest right now. I think it's important to just have context about this whole thing. And I guess one of the things I'll just throw here with is I think sometimes when we hear the same story and over again, we kind of just tune out a little bit. But I would suggest that's not always the way we do things. So a lot of us remember the movie Jurassic Park. There's my dinosaur here, right? I'm showing you dinosaurs right now because why not, right? If you guys think about every Jurassic Park movie, isn't it really the same movie? People are actually surprised they could find dinosaurs. People surprised that the dinosaurs get out and ate people. then people are surprised they actually should leave the dinosaurs alone, right? Every Jurassic Park movie is the same. They still make over $1 billion a movie, and there's another one coming out next year. Maybe we'll see in theaters, right? My point is, we don't get tired of Jurassic Park. Why are we getting tired of the pandemic? Well, because the pandemic hits us every day. It's caused us pain every day. And we've all gone through a little bit of trauma because of the pandemic every day. I can't take away the pain or the trauma. All I can do is explain what's going on here. We're in a difficult time, though. I think those people who are in the behavioral health industry in particular, it's like, yeah, it's a very difficult time. I, as a pediatrician, prescribed a lot more Lexapro in the last year than I did amoxicillin. The anxiety is affecting our children, affecting all of us. I think we all need to do our part to mitigate the impact of the pandemic. If there's one thing you can do, if you haven't gotten a vaccine, I would just say, I'm not sure what your question is. I'd be happy to answer it for you. But if you have not gotten a vaccine yet, let's go ahead and get that done, all right? Because it's a safe vaccine. Well over 150 million people have gotten the vaccine. Over 2 billion have got it in the world. It's good enough for them. It's good enough for you. Let's go ahead and get that done. I think another thing you can do is, let's just think about how we can be a positive impact for others around us. When you think about going through a population stress and a population trauma like we've done, I think those of us in the behavioral health industry know there's a lot to be said for just letting people decompress from that trauma, let people have the space they need where they can. I hope you'll do what you can today to make people feel a little more relaxed, a little more informed, and really understand the context of the pandemic a little bit better. Hey, where are we now in the pandemic? We have a completely preventable disease. We have a treatable disease. We're heading in the right direction. And I really thank you guys for letting me be part of your conference today. Hope you have a good rest of the day. Thank you. Dr. Jim McDonald, Medical Director of the Rhode Island Department of Health.